through the pandemic, a lot of people took a look at what they were doing every day, and were trying to figure out if what they were doing every day was bringing them joy. Where we find joy is when we're actually taking care of a person, and when we're able to look at someone and chat with them and help them with their problems and help them find a solution to make them feel better. That's what brings physicians the joy. What doesn't perhaps bring the joy, though, is the rest of medicine. So the business side of medicine, the governmental regulation side of medicine. And then, of course, there are other issues that are now where politics may be taking a play as far as what's happening in medicine. None of that was taught to us in medical school, and how to handle all of those things weren't taught to us in medical school. I think those are probably some of the biggest challenges we're facing today, is how to still fill our cups with the work where we're seeing patients and taking care of individuals and not getting distracted by all the other things that are going on around us. The other day, I had a colleague come to my practice to say, you know, Sandy, this just isn't fun anymore. This is a physician who's been in practice a long time. They've taken care of patients their whole lives. And then suddenly, what they're finding is that they're missing the joy, the peace behind medicine that makes them happy, that drives them, the care that they're delivering. There's a lot of work that needs to be done with physicians to reframe how we're thinking about healthcare. How are we thinking about our day? It's so easy in today's climate to focus on the negative. And so teaching ourselves, to think about our day and to think about the patients, the 18 patients we saw today, where the visit was amazing and the visit went well and we helped others, as opposed to focusing on the couple of patients where perhaps the interaction wasn't nearly so positive. People in general are more anxious, more depressed, more concerned about things and less able to tolerate things. And it used to be that we could be a partner. But now instead, in the exam room, sometimes we're being approached as the enemy. And I think that moral injury that happens over and over and over can be such a challenge. And so having something like SafeHaven to help physicians understand that we need to reframe how we see our day. And we need to reframe how we're interacting with our patients, that we're still helping others, that we're still doing good work. And that's so important for us to focus on, and having something like SafeHaven will help that.